Okay, and before we begin the meeting, we are still required to read from this script because some people are online. So bear with me, please. As a preliminary matter, I'm Mary Ann Easley, Chair. Permit me to confirm all members and persons anticipated on the agenda are present and can hear me. So Abby, can you just say here? We know you're here. Rocky
Is it Abigail Camp or
Abby, yes. Abigail Camp,
Abby?
yes. Bob Kucharavi.
Here.
Aaron is not here. Arlene O'Reilly.
Here. Yeah, Abby.
Abby, we know you're here. Thank you. Jude is not here. Linda.
No,
is-
I am.
Oh, good. Okay, thank you. All right, Jude is here. Linda Williams. And myself. Thank you. Okay, we have two speakers today. And I just want to make sure that they are accounted for. So Kelsey Gray and Joe Aguirre is also here. And
Aaron will be speaking under my updates as well. Just want to introduce her as the
Okay.
community health nurse.
okay, and Aaron, what is your last name?
Schrader.
Aaron Schrader is the new nurse who's at the Salt Marsh regularly.
Sorry,
And-
could you spell your last name for me?
Yes, that's Schrader, SCHRADER.
Thank you.
And Jericho is also here representing the town.
In attendance.
Okay. This open meeting of the Council on Aging is being conducted remotely, partly remotely, pursuant to Chapter 2 of the Acts of 2023. Ensuring public access does not ensure public participation unless such participation is required by law. This meeting will not feature public comment. For this meeting, the Council on Aging is convening by video conference via Zoom app as posted on the town's website, identifying how the public may join. Please note that this meeting is being recorded and some attendees are participating by video conference. Accordingly, please be aware that other folks may be able to see you and to take care not to screen share your computer. Anything that you broadcast may be captured by the recording. And please remember to mute your phone or computer when you are not speaking. And please remember to speak clearly in a way that helps generate accurate minutes for our secretary, Arlene. Okay, thank you, everybody. I need to get approval of the minutes of the last meeting, which was actually held in May because we did not have a meeting in June due to not having a quorum. So can somebody please move to approve the minutes of the May meeting?
Bob will move it.
Thank you. Is there a second?
Second.
Hi, Rocky. Thank you. Okay, I have to do a vote by everybody. Please, yay or nay? Abby. Approval of minutes.
Yeah,
Gotcha.
We're gonna meet in person from now on.
Minute.
Rocky?
Yes.
Bob?
Yes.
Arlene?
Yes.
Jude?
Yes.
Mary Ann, yes. Thank you.
And Abigail, one quick help, you're cutting up a little bit when you talk. You might want to turn your video off. That might
Yeah.
save bandwidth.
The next thing on
video.
the agenda is
Okay.
approval of the agenda for today. So again, I'm going to go down the list for everybody to say yes or no if you disagree. So this is approval of today's agenda, which you all got in advance. Abigail Camp. Yes. Rocky.
Yes.
Bob.
Sorry, I did it out. I did. Yes,
Arlene.
Yes.
Jude.
Yes.
Mary Ann, yes. Thank you. Okay, now to the meat of our agenda for today's meeting. We do have two speakers today. So I hope if people have questions that you can hold them till the person is finished. and we'll have plenty of time for questions. So our first speaker today is Kelsey Gray, who is with the Visiting Nurses Association and handles hospice and maternal child health. So I want to thank you for coming and for telling us about what you're doing in terms of what can help seniors on Nantucket.
Yes, so we actually have a little bit more even than just hospice and maternal child health. So we have 4 kind of what I call programs. We have our certified home health, where we're seeing people who had an acute event. So someone who is just hospitalized for an episode, say pneumonia or a stroke or a heart attack, and we go into the home and we're doing nursing in the home a couple times a week, depending on the patient's need, physical therapy, occupational therapy. We have a health aide to help someone get back short term to what is their baseline or sometimes a new baseline. And then with that, you know, we're helping guide adding in private care if someone needs additional help for long term. And that's an insurance-based program. So traditionally, you know, going to Medicare. So they're dictating, you know, how long we're in the home for and what justifies progress to keep staying in the home. Then we have our hospice program, like you mentioned. Hospice is for anyone who is given a prognosis of 6 or fewer months to live. We can go in and do an info session or an eval pretty much anytime. There's no harm in going in just to talk about what hospice is and what we can be. Our visits for that, you know, range from 1 time a week to 1 time a day. And we can have our health aide in there. And that's, you know, for someone who has an end stage disease of any form, whether it's dementia, cardiac status, pulmonary, whatever it is. And then we can stay in through end of life and keep someone comfortable. So the word hospice gets, you know, it's just scary for most people, but a lot of people I find because of the fear of the word hospice are only utilizing this benefit of free care and someone to call 24 hours a day for the last, say, month, once they really understand, like, this is what it is. But we have people who are on hospice for 1.5 years, where you're just seeing that functional decline, and that justifies keeping you on service for longer. And then our 2 newer programs fall under our public health branch. So we have our maternal child health, where we're seeing prenatal and postpartum moms and babies. And we're, you know, checking on moms who, so while they're pregnant, we can follow moms who are young, under 24, non-English speaking, or English as a second language, underinsured or uninsured. We're seeing moms who have a history of substance abuse disorder or mental health disorders, and we're supporting them through their pregnancy in addition to their visits with the hospital. So that program is fully grant funded by the Health and Human Services Department with the town. So all of those visits are covered and free to mom. Then when someone is postpartum, so just had their baby, that's a billable skill, again, to their insurance, as long as they have insurance. But with this grant that we have from the Health and Human Services Department, if someone is uninsured or underinsured, we're still allowed to see them. The town just pays for it. So we're able to see pretty much all moms that are having babies at the hospital. And that's been huge for the hospital, freeing up space in the clinic. Because what we're having moms do is moms were going into the hospital at 3 days postpartum for baby to have a weight check, 1 week postpartum for baby to have a weight check, and then 2 weeks. You know, and then again at a home. So now we're doing all of those first visits, and they're not going to the hospital until 1 month, which is a huge savior for a lot of moms, especially when it's a second, third, you know, however many kids. And then now our newest program is working with Erin almost as like a branch off of her, right? So she's able to defer some of it to us. And it's a program where we can be town nurse of Nantucket. And it's just something that the town has not gotten into yet, because they just didn't have the capacity of only 1 RN. So with our town nurse program, anyone can call and request an eval, or you could refer your neighbor or someone, you know, down at the salt marsh who, or anyone in the community who needs more support. So when we're thinking about our like skilled nursing program that's insurance-based, those visits, there has to be a skill, which means something to teach someone, and it's short term, and it's driven on teaching someone to be independent of their own care. But when we're thinking of this town nurse program, anyone can be referred, and it's more to help guide someone to other services. So when I met with, is it Laura that works at the Salt Marsh? So when I met with Laura in summer, she was saying, I actually don't know that we would be sending you any referrals. It would be almost like you would be getting these referrals and referring them to us. So how can we help the people in the community that want to get to the Salt Marsh actually get to the Salt Marsh? So we can see people once every other week, once a month, you know, whatever it is to get them set up with the resources they need. Whether that's food insecurity, access to appointments, just kind of an extra check-in every once in a while. Setting them up with elder services, Meals on Wheels, anything like that. So what was happening, my understanding is like the fire department, if they were seeing people in the community that needed more support, they were just calling Sherry with elder services. But what was happening with that is in turn, you were almost losing out on like what else could be available to someone, because Sherry with elder services, for example, we use that because that's easy to think of, is that like she's income driven, age driven, things like that, of like what someone's eligible for. Whereas if you refer to us, then we can help determine like what are the factors that you would need eligibility for, and is elder services an appropriate referral or something else an appropriate referral. So we can send it in more places, if that makes sense. This has been a really cool program to be building right now.
You know, they've been extremely busy. We actually, I think we started working on increasing our partnerships last fall.
Yeah, so we started postpartum March of 22,
Yeah,
and then prenatal, we started, I want to say like October,
I think so.
maybe, of this past year. And then the town nurse, we really only just picked up in May, maybe.
Mhm.
But I mean, it's been huge. It's been really great.
You're only one person though.
Oh, it's not just me.
Oh, okay.
There's a couple people from off island who we've been working with quite a bit. And then I do have, how many staff do you have on island?
So I have about 4 physical therapists, and I have 1 OT, and we use Tucked In, Erin's company, as our health aides. So she has 1 million girls, you know, that she sends out under us. And then I have maybe 9 nurses. Yeah. And we're all local, we're all here year round. You know, everyone has this idea that because we're Cape Cod Healthcare, we're taking the vote over every day, which I think is just hysterical, but no.
She lives down the street from
Yes.
me. I have seen her enter the neighborhood.
I'm sure he hears me yelling at my children.
What are you doing?
Well, I'm sure that people are gonna have questions, but I have to apologize, Erin, that I haven't coordinated how this would work. So I'm not sure if you want to jump in here and talk about how the 2 of you are coordinated and then have everybody ask questions of both of you. Does that
That's up to
work for you or?
I was initially gonna put her in under the updates from Human Services Department, updates from the Human Services Director. If it's more natural for you to be doing this now, then it's entirely okay.
Or you can come back to our next meeting and. Holy thing.
Our certified, the only thing I would just say is our certified, like skilled nursing and our hospice are completely separate from our town programs. So our public health and wellness programs are in conjunction with Health and Human Services Department. So that's the only thing I don't want to get.
So maybe I should open this to questions for you now and you can decide, Erin, if you wanted to jump in or, I mean, it's a lot to learn about.
It
in
is,
one
and I
meeting.
think my initial meeting with Kelsey. I don't know. I think we probably talked about all of the programs that you guys are doing and our coordination. I've only been in my role since May 1st. And I left feeling like that's a lot of information and like a lot of programs and. I think we're really lucky to have you guys in the VNA and all the staff and the resources that your organization has. It's, I think in some ways almost kind of like a resource clearinghouse, kind of like, well, if I'm not quite sure where to direct them, or like if I know there's some clinical services, then I feel comfortable and confident giving VNA a call or giving your number to somebody if they were to call.
So you can chill if you want at this meeting. Back next time. But I want to make sure that everybody gets a chance to ask questions. I have many, but anybody else? Those of you who are joining us online,
We can start from the phone lines, if we could, so to speak. Any questions from Judith, Arlene, or Abigail regarding the visiting nursing program?
No, I'm good.
Judith?
I'm good, except I wonder where is this information posted? For, I mean, for everyone to see, or does it go through your doctor? Or if you call the hospital?
Yeah, so our skilled services, between certified, skilled nursing, hospice and postpartum, those are all coming directly from, the physicians. And we're operating under orders from your primary care doctor primarily, sometimes a surgeon. If you just had a total hip replacement, for example, we'll go in and the surgeon's directing the orders. But the town nurse program that we're doing now in conjunction with Town Nantucket, that's the hardest thing right now is figuring out how to get that out, because hypothetically, like I said before, you should be able to refer your neighbor, if you, and it should be easy to get that information of who to call and how to do that. But we just need to work on that marketing, for lack of a better word, to figure out how to get that information out. Now, and then similarly, our prenatal program, I mean, we've gotten referrals from the Nantucket Family Resource Center to us, with moms that need support, and then vice versa. So like we're referring back and forth to each other in an interesting way. That's been really cool to see.
Okay, thanks.
I think we're okay from,
have we covered the people who are online?
I think we've covered the remote questions. Any questions from the room, Rocky?
Yeah, hi, my question was pretty much the same. Where would someone go to? Where would the beginning spot be for get this information? Because if it's daunting for her, how daunting it is for someone who's an elderly person looking for this service, or a caregiver for that matter. So if there would be just not one spot, if you had one spot that could spiderweb off into different areas and make it so that it's not hard to find.
Right. So my opinion, and one thing that Aaron and I have talked a bit about, is that we need to bring as much as we can back to the town to then disseminate out, so like if people know that they can call you guys and say, this is what's up, where do I go with this? Then you can refer out essentially. So Aaron has like our referrals form, so people were calling her department and looking, for what services were available, then she could refer to us. And then again, it's just kind of figuring out, we're working on, I know it's with the Cape Cod Healthcare marketing team, trying to make, flyers even to put up at Salt Marsh and things like that for the town nurse program. But I mean, we haven't had issues with our insurance covered programs that we've had, going for years and years now. Because all the doctors know about it and they know to refer to us, and that's not a problem. It's just now this new town nurse program that could be a support and how to get this out. But again, we really only started seeing our first town nurse page in May. So we're kind of learning as we go a little bit here.
And I think I at least have a couple of plans to include them into the resource directories, to spotlight stories on them. I may actually ask you to contribute something to the town manager's newsletter coming up this next month.
Yeah.
Not you specifically, but VNA.
Yeah.
But there's some definite marketing opportunities we're working on. I am trying to figure out the best way to present this online so that that there doesn't need to be anyone on the VNA or town side participating to get information out, primarily so that children can recommend services for their parents for the most part. And then, but anytime there's a service or a human service related problem that anyone has and they're looking for resources, the best place to ask is me. I will track down who it goes to. If there's somebody who's looking for services, send it to me, and then it will percolate through to everybody else who's in the human services field. That's sort of like keeping the big list of who does what, and is one of the things that's in my brain some of the time. So that's a good place to start, and then I'll find something from there.
So have you ever thought of getting one general phone number for people to call in, and then they can hit options from there, spread out with different information? how to reach?
We experimented with a couple of things like that during the COVID pandemic around getting people to clinics. The trouble is our phone system is not set up to do that, and that is controlled thanks to some deeply arcane budgetary restrictions under public safety. That's the internal phone systems we've had at public safety. So we can work with that. It's just been logistically a real nightmare trying to set one of those up. The other thing we're looking at is partnering with, there's a couple of nonprofits doing what they call backbone services, which is where they don't do services for people, they do services for nonprofits. And they're trying to set up a one-stop phone line for not just elder services or behavioral health or senior affairs, but for anything human service that'll carry you from point to point. Basically, a phone version of what you're describing. I don't know when it's gonna be done.
It is really hard, you know, because Nantucket does have so many resources available and funding for this and programs for that and, you know, free this and free that, but it's not anywhere in one place. I mean, for example, like the hospital didn't even know that the fire department has like 30 car seats just sitting there waiting for moms that need them, you know, and it's like, how are these things like so missed, you know, and how do we all like just work together to put them all into one place? But there's just so many resources available that I think, like you're saying, like things just get missed so easily. And that's been a lot of, you know, what I've been doing since probably April, March. Is, you know, I've sat down with the chief of the fire department and said, you know, like, if you guys go out on a call and you think they need something more, but they were refusing to transfer to the hospital, you can refer to us. Same with dispatch. So off island, the police department will call VNA and say, hey, you know, this person's called 3 times in a week and they won't go to the hospital, but can you go and check on them? So then we can go out that way and get a referral from them. So it's just been, you know, sharing what we can do to all of these different programs. That's kind of why we're here today. Just trying to formulate ideas and pull things together.
And how are you coordinated with social services at the hospital?
We're not.
Guess that's the
That's
next
a big
interaction we have to
gap.
make.
Yes, so I mean, we can refer back to them, but you know, we can't really communicate too much together because of you know, we can refer to them and give them a brief overview, but there's not much back and forth because of HIPAA and things like that, just protecting privacy information.
I'm not talking about knowing about the details of a person, but just coordinating, sending people to the right place.
Oh, yes,
Because all of us even, you know, we know people who call us and ask for things. I've been referring people to social services at the hospital when they say, I need a special tag for my car because now my husband has to go to Boston regularly for treatments.
Oh, okay, yes, I
And-
see what you're saying.
You know, there are a
Yeah.
lot of dead ends and I was willing to trace those dead ends for a while.
So my opinion also is that like a lot of those things, a lot of those forms, things like that, they don't, if they're in our program, we're doing this with them. You know, we're not sending them back to someone else to do it for us or for them, we would be helping.
So
someone
I could
with
just
that.
send somebody to you.
You could, yes, yes.
Good.
And then we would be helping set them up with Meals on Wheels, set them up with, you know, I didn't even know the food pantry does delivery for people that are truly homebound, you know, and, you know, setting people up with just whatever they need, you know, a lot of times it's hooking people up with, the, Martha Sealy, you know, to the funding
Oh.
through the,
Martha.
yeah, for
Yeah.
Martha. So you know, hooking people up with the right programs and helping them. So like with our postpartum patients, a lot of times we're sitting down and doing the form that gives them, you know, their 12 weeks off from work, and we're doing that with them so that the doctors don't have to do quite as much. So I think that's similar to what you're saying, is that instead of maybe us sending it to social services, we would be doing the form with them, because I'm pretty sure like a lot of those with the stickers for the vote, the passes for the vote, it's a form that the steamship has that you just fill out and you have your doctor sign. So we could do that.
Just
with
yeah,
them.
helping people
Yeah.
even know what that is. They don't know where
I
to
know.
start. Yeah.
Exactly.
Okay. Any other questions in the room?
I do. So if I Googled Nantucket Town Nurse, would your info come up?
No.
Okay.
I think, and I have to test this right now. You get the health department, which is us, and that would be, that would connect you with, Aaron. And then from there, referrals can go in either direction from VNA to like the town nurse like that. So there's no like any, if you get in touch, you get in touch with us or you get in touch with VNA, we'll be talking back and forth about what services we can connect you to and what we can do. I think, yeah. Unfortunately,
Okay, so repeat that. So if I, just because, I mean, I love the idea of town nurse, you look it up. Nothing would come up or it would go to Board of, I mean, it would go to you.
it brings you to the health department. In fact,
Okay, something comes up.
Yeah, I can share what you get.
Okay,
This is what you get. Town nurse, you get the health department, there's all, the shared one will. Do this.
okay,
Can everyone see this?
Yeah.
So if you type in Nantucket Town Nurse, it's gonna take you to the health department. The health department gives a couple of contact methods. There's the main health department line, which you can always call. There's the health department email list. If you send something to either send or call anything to those 2 points, we will follow up on it. We will reach back out to you and try and connect you with who you're looking for. That's sort of like a major part of what I have to, what I do. But the whole topic of, I'm about to start broaching the fact that we need to be paying Google to promote certain search terms. And that's gonna be a whole battle because I don't think people know that you have to do that, and that's how you find stuff. But that's like next on the list. Well, not next, it's like you're down the list. Yeah, it's on the list.
Are there any other questions or comments from anybody on the council? Let me thank you very much.
Of course,
I'm
thank
glad
you.
we could get you before.
Yes.
you-
And if anybody wants to follow up or has any requests or questions about getting in touch with DNA, either myself or directly through Kelsey, if you have her contact information, I will make sure you reconnect everybody.
So maybe you could send all that to Arlene so she can put it in the minutes.
We'll do.
Thank you very much. And thank you, Erin. We'll have you back for sure. We have another speaker today because Joe Aguirre is leaving the island, which we are losing somebody so valuable to seniors. So I'm really sorry to see him go. But I didn't want him to leave without giving us kind of an overview of what he sees as issues that seniors are dealing with on Nantucket that we could possibly address. So I wanted to hear what's on his mind before he leaves, and so I asked him to be here, and I want to thank you.
Thank you for inviting me. Appreciate it. When I was driving over here, it registered on me that we spent 23 years here, which is the longest place that we ever lived. In my profession, you tended to move. And in that period of time, I believe I was on the Council on Aging 6 years and with the NCEA for 12 years. So I have a lot of history that I'd like to address to you so that you would know, at least do it quickly. But what I would like to do is, if you have a question, I'd like you to ask it with your permission when you have it, because I think I don't want you to wait, but at the end, if you have other questions, I'll ask it. In my opinion, the Council on Aging has two signature programs that they've had for a long time. One is the Elder Expo, and the other is the Senior Man and Woman of the Year. And I'd like to address those two because I think there are some concerns I have with that. The Senior Man and Woman of the Year started actually as the Senior of the Year. And sometime during the course of the COA, they determined that there were more people who should be honored than just one individual. So they set it up to be a man and a woman of the year. And basically, these people, if they weren't legends before they were appointed or selected, became legends because they contributed a great deal. And how it was set up was that they would have this banquet. The honorees were able to bring 4 guests. And any other guests that wanted to come had to pay, and I forget what the fee is, I wasn't really connected with that, but they paid a fee. But more importantly than that, the way it was set up was, it was for the honorees, their guests, first and foremost. Secondly, it were people who helped the Salt Marsh Center in many ways. They may not be connected to any program, but they were there to help. And they were invited guests, and again, they did not have to pay. And then after that, there were invitations to the Council on Aging members, invitations to the NCA members, and so forth and so on. And that is a concern I have. I think that this year there was a breakdown in communication. When I went to that banquet, it was like a song from Les Miserables, empty chairs at empty tables. There were 24 empty seats in that place. And I think what happened is the people who help at the Salt Marsh were not sent on as guests. And I think that was a mistake. So again, I want to repeat, it goes to, first of all, the honorees and 4 guests. Secondly, these people who help at the Salt Marsh Center. Thirdly, members of the organizations. And after that, it certainly would be for anybody who wishes to come and wishes to pay whatever, fee. That's not a dilemma. All you'd have to do is call the restaurant, find out what each meal is costing, and that's what you would charge for them to come. The other aspect about that is I think that requires coordination that you're going to have to deal with. I think everybody has to be contacted to notify them that these are people who should be referred to the list. I understand, now this may be a rumor because I can't prove this, but I understand some people called and wanted to attend and were told they could not attend because they were not on the list. Yet as it turned out, 24 empty seats. And I think it was the people who were on it, as usual, were outstanding. And I think we missed something in that area. I think that's one that has to be addressed. The second thing that I think has to be addressed, and the second most significant thing that this COA does, is what was called the Elder Expo. It started as a program at the high school. All the organizations in town brought people in, had desks and so forth. And they had programs and provided material to people, whether it would be law, health, education, activities, things such as this. And it went well. And the last time they had it was last year. So it was held last October of last year. For some reason, and let me introduce something first. The grab-in was people would get free flu shots. That was the draw, get flu shots. But then all these other activities get involved. I think sometime last year, the hospital caught wind of this and found out that maybe it was pretty successful and had it at the hospital. It was probably the best Elder Expo that was had in all the years that I've been associated with it. And I think it was the best because they still got the flu shots and they went to the hospital, and the hospital really paid a great deal of attention. There were lectures from doctors, other programs, physical programs, and I think it was well. That program should be done this October. Okay, it should be done this October. COVID killed it one year, but I think that this year is a great opportunity to do that again. Those are 2 signature programs that I feel that the Salt Marsh, that the COA has done and has done successfully. You know, in all my experience with seniors, I've discovered that I don't think I've seen any or remember anybody who served on this board, the NCA board, was a volunteer at the Salt Marsh, who wasn't there because they wanted to improve the quality of life of seniors. And I think they also, by improving the quality of life of seniors, improve the quality of life for themselves. So those are my concerns. That's the historical perspective of it. It just grew. It grew from honoring one person to honoring 2. It grew from, just an Elder Expo that, had the flu shots, and then it gravitated to the hospital. I think it can be going forward. Let me make this statement. I am not connected in any way anymore with the NCAA. So what I might say, don't take it as something from the NCAA, it might be for me. there is funding in the NCAA to do these programs. Okay, when we started it, the NCAA was a lot reluctant to give money for this project. But now, because of a transition in terms of the NCAA, in terms of fundraising and the ability to write grants and so forth, there are funds available to do this. So the answer can never be, in my opinion, we don't have the money to do this. And I want to make that point clear. Now, who do you invite other than the people I mentioned? I think you absolutely have to invite the town manager. He absolutely has to invite the, Salt Marsh Center director. And you have to invite somebody from one of the state offices who represent this district. That's it, and for the following reasons. The town manager responsible for the town. The person from the state brings the award from the state House of Representatives. And that adds to the honors there. But I guess that's the gist of my experience. I've never found anyone on any of these committees who wasn't here to do something to improve the quality of life of seniors. And that's my pitch. Any
And
questions?
Yes, actually, I don't have a question, but I want to assure you that the very, very first initial planning has begun on this year's Elder Expo. The thing about it is that it's now in the hospital's bailiwick because it's on their turf.
Right.
So we have less of a voice than we used to have when it was just the Council on Aging, when we could call all the shots. Now, the hospital has a big say in it.
Well, that's all right,
But I
because
think-
if it drags their doctors in, that'll help a lot.
Yeah, I think they're committed, and
Yeah.
I'd like to do a little plug here for anyone on the Council on Aging who wants to get involved. That would be fantastic. It is work. It is putting up with all the whatever goes on when you plan a big event like that. But last year's was actually kind of half of what it had been just before COVID. So I'm hoping we're going to be back to both floors of the hospital filled with vendors and people who serve seniors. I don't know yet because we haven't actually had a meeting with the hospital. And as I said, they call the shots, but that's what I'm hoping for. Back to the big thing that it was before COVID, because people need to be there in person and be able to talk to seniors. So that's what I'm hoping for. So please think about volunteering, even though it is a big commitment. So thank you.
Well, physical health is important, but socialization is absolutely essential. And I think those programs provide the socialization that people need. When we were doing it at the high school, we had to, arrange it around the football schedule because it was always in the fall. And then we had to put covering down over the gym floor so that wouldn't get ruined. And you'd run to, you'd have what did you think of the expo? Oh, it was fine, but I tripped on the mat, I tripped, there's always going to be a negative connotation to something that far is outweighed by the positive connotation to something. And these are signature projects that COA has had a time immemorial. And my concern is that they continue to improve. And I think with volunteers that you suggested, that it's absolutely essential.
I would like to comment though about NCEA has been doing more activities because they've gotten grants and they have money to spend in the salt marsh. And there is not perfect coordination between the town and the NCEA. And you can see that it's just, I think it has to be much better coordinated. So we're not getting, well, that's their job, or that's their,
Right.
It really needs to look seamless to the people who come into the salt marsh for whatever activity. And that's going to be something to overcome, I think.
Yeah, well, that's the point I'm trying to make. When people talk about the lack of funding, make sure that there is a lack of funding. That's my personal opinion. I mean, you're right about that. The NCAA gravitated into a fundraising thing and went through grant writing, all of these after-school programs. Now, the CAA basically is an after-hour program. It's either on after 4 o'clock in the evening on a Saturday, on a Sunday, and that's fine. But yeah, I agree. I think there's got to be coordination on who should be involved, who should come and so forth and so on. You know, we live in the same town, or you live in the same town, I won't, but we live in the same town. I mean, you gotta communicate, and again, I want to really stress that. The physical activities that's provided, the entertainment that's provided, the information that's provided is outstanding. But socialization is absolutely essential.
Did the hospital give you any dates yet?
Yes, we do have a date. But I didn't bring it with me. And yes, I can't remember the date, so I don't want to just word out a date, but I
October,
can.
right? It's in October still?
Usually October.
Yeah, it's usually October, and Arlene, I'll give you the date. I'll email it to you so everybody can see, but the hospital chose the date, so that's the date that works for them. But, you know, it'll work for us, whatever date they choose.
Well, as I say, I think the improvement was by moving it to the hospital. You had more access to doctors and information provided. I think. Of the 2 years that it was there, I know Dr. Monto gave addresses at both of those and other doctors did. And they actually did some physical activities with people too. It really worked out very well. So I think. You know, maybe the hospital is more, that may be there, Bailiwick, and maybe it should be there, Bailiwick, the first one, because they have more.
Yeah.
But other agencies, you know, insurance agencies come in, attorneys come in, a lot of people come in. It's just a outstanding program. It has been from day one, but I think it's really, really improved. But it requires, as you say, volunteers.
Yeah,
It
so
requires-
think about volunteering, everybody.
I guess I'm only just wondering if the hospital, if the doctors presenting at this are doing that as volunteer time, or if the hospital's paying them for that, because that's the difference, first off, right? Otherwise, why wouldn't you want to hijack it back from the hospital and take the credit for it? Now that you have town nurses who could do the vaccines, you know, at it, you know, and you guys take the credit for what you're doing. I don't know.
Well, you know,
Maybe
it's
that's not the right
credit,
idea,
it's
but-
credit is important, just the having it done. I
Yeah,
mean,
to me, the
Right.
services are as important. If the hospital is able to deliver a large number of doses while they're doing a health thing, then they're happy to, I'm happy for them to get some
Right.
PR out of it. The trouble is that there are a lot of people who don't fit into that category. If the hospital wants to take the easy set of people to vaccinate, that frees us up to do the
Yeah.
people who aren't getting it through existing.
As long as it's helpful, I'm
Yeah.
not, you know, pulling away from what, you know, if you guys are doing all the grunt work of volunteering behind it, then why would they be running? I don't know.
Oh, they're doing tons of volunteering. I don't think we have participated as much as they have
Okay,
on the volunteer side. That's why I hope everybody will get
It is
involved
largely
in some way.
So I think it was in the fall of 21 that this proposal was first reached, and it was largely going to be that the hospital
Right.
would take over.
okay.
Yes.
Yeah.
Yeah, they-
It was there 2 years.
Yeah.
I was 21 and 22, and then this year, it should be, it usually is in October. Now, I don't, it could be, I guess, any date.
Yeah. I
When it
can't
was at the
remember
high
if
school,
it's
it was
October
connected to
or
the football.
September.
schedule.
I'm pretty sure it's still in October, but that's one of the things I have to touch base with.
No, I
It has to
I
do
looked
when
it
the
up.
flu shots are available. That, I can tell you that.
Yes,
That's how they started to,
Yeah.
that's how they chose the date.
Yeah.
When is the vaccine available for regular flu shot? And so
This,
they chose it around that.
this year, it looks like there will be a variety of different services getting flu and COVID combined shots together. We're probably gonna have more individual clinics this year than we have at any point. Certainly since I started. I currently have funding together for us to do vaccinations. We're partnering with them as part of the town health nurse to do the small to medium sized clinics. And we've got an onboarding process for homebound COVID and flu clinics. And then we have the state hopefully coming down multiple times to combine flu and COVID vaccines at the high school using roughly the same model they've been doing with COVID. So we should have much better flu and COVID coverage this year than we have ever had in the past. The general way it's worked out for hospital logistics is that it is, if there's a high volume day or clinic setting, they are better at doing it. They have the technical support, they have vastly more injectors than the other organization. And they have a multi-billion-dollar IT backbone to run everything. And then when it comes to being flexible, off-site vaccinations, pop-up clinics, partnerships with organizations like Salt Marsh, the various senior facilities on island, that's where we come in, because it's easier for us to do that. We did it for 2 years in COVID. And we did more COVID vaccines than anyone else on the island, including the hospital. So the one thing I'm pretty happy about with the community health nursing position is how is setting up and running clinics. That's definitely one of the things we are fairly good at doing.
I'd like to commend the COA too for continuing that aspect of having like Bob go across to represent Nantucket's seniors on those councils, the elder services councils. That's an extreme value experience. I had to do that, I did it for 2 years. Because you get a lot of ideas from other people. You have an opportunity to see what grants have been issued, so you get some ideas on grants that you can take back here. I mean, a grant to one council on aging doesn't mean you can't have that same grant to another council on aging. So I commend you for that. And if you have any other questions of me, I'll be glad to answer them.
I have one question.
Yeah.
With my work with the Boys and Girls Club in the Nantucket Star program, you talked about grants, and people always get hesitant because they see how much grant writers cost. What they don't realize is there's grants for everything. You can find a grant for anything and everything, and that's their job to do due diligence. And you might get sticker shock when you get the price of what he's going to charge you, he or she's going to charge you. But if you get those grants and they're reoccurring, you paid for that one grant writer over and over. It's a daunting task to find grants. Let's be plain and simple. But like you said, it's like free money.
Right.
It is free money.
It's free money, the administering of which can
Yeah.
sometimes be, so I agree, like grant writers absolutely pay for themselves. The administering of the higher, more complicated grants is non-trivial, but a grant writer pays for itself. Because finding the grants is easier than applying for the grants, which is easier than administering the grants, which is easier than giving the money out. Well, actually, no, the money is the easiest part to give out. But I've been trying to get a letter together from all of the town departments for the hiring of a town grant writer. Or a relationship with an existing grant writing consultancy, so that you would be able to lease time from all the different departments to get one on there. I may ask you to sign that letter of support at some point in the next couple of weeks.
First
Yeah, I'll give you a good example. The entire interior of the Salt Marsh Center, the roof and the interior ceiling was all paid for by grants, not by out of the NCA budget. So those are, and that's within the last 3 or 4 years. So I mean, that's an extremely important part of the process, the grant writing. And I agree with Jennifer, if you could get somebody to do that, that'd be outstanding.
Because I have administered a couple of grants personally. A professional will make everything vastly easier.
Right.
Like, wouldn't it have been awesome if we had just had one person who was the interface between us, finance, the grant organization, well, like,
I won't even go there.
yeah.
Yeah, because I was a free grant writer. I didn't cost anything, so yes.
They love
They
you.
got it off of me. When you have to administer this thing, there are plenty of dead ends.
But I mean, and this is the thing that I think the government, like local government, especially and non-governmental organizations without like a strong need to make profits every year. That is, we can make that the investment into administering the grant will save the entire community money on the whole, even if it costs the town money to secure this resources. But I mean, there's $6 million worth of grant opportunities that have passed through my inbox in the last 6 months. Last 6 months. Unfortunately, you never see them until a week before the due date. And then
That's true.
it's always the problem when you're writing the grant application. And then I don't have sufficient manpower to administer one federal grant as we're currently set up. So it is absolutely like there is millions of dollars of funding out there. It's just a process of actually setting it up. So it doesn't require one hero person to be the funny grant writer. the entire time. We have to set it up on a sustainable, like structurally built system, basically.
Yeah, during my career, I've been very fortunate to fight right, a lot of successful grants. But again, that was my career. I mean, I needed money for school, so you wrote grants and as you said,
He's your
a lot of
first
money.
applicant. He can write these.
I know, you're looking for some remote work.
Are you looking for some, fill up some free time since you're moving up, man? What are you gonna do with all your volunteer time that you spent here?
You keep saying you're tired.
I'm retired.
Just 1 grant a year. That's all we're looking for.
It's like-
Starts with one, doesn't it?
Do you have any other questions?
No, sir.
Anybody else who's not in the room? Do you have any questions or comments for Joe? Well, thank you so much.
Okay.
I really appreciate that you.
Well, I'll tell you, I just want
Mr.
to
Winston.
say it was really for me, it was a privilege working with Jethro and for a short period of time. And a privilege working with you.
Thank you.
I think you're part of all the success of the NCA has to do with your contributions to it and just continue, it's not going to change. There are always going to be seniors
And more of them.
and more of them. So, and if you don't mind, I'd like to be excused. I have other.
Oh,
Go ahead.
please, go right
Okay,
ahead.
thanks very much.
Thank you.
Nice meeting you all. Take care and good luck.
Thank you.
As far as our agenda goes, we're gonna have to make some adjustments here because Bob had to leave for an event at the Whaling Museum. So we're gonna jump to Jericho and his report on human services.
Yep, and we'll go relatively quick. Current work that this Human Services Department is working on, and Medina, who is our business manager for the last 20 years, has retired as of last Friday. We are hiring a new person. Interviews for that are scheduled for next week. We should have the person on board very shortly. In the interim, please make sure any messages that you use to send to Angelina go to me as well. Then after onboarding the new Angelina, we also had our new community health nurse. You got a partial introduction to her. We'll do the rest of it right after I'm done catching up on what I'm up to. The last meeting was in May, so in the previous 2 months, it's been a lot of work on the youth behavioral health grant, and then we're starting to branch into the conventional non-youth related grant season. So we're doing some very boring bookkeeping stuff there. That will hopefully make it a lot easier to apply for grants and administer them going forward. After that, we've got, we had an unfortunate set of behavioral health crises in the last couple of weeks. So my last 2 weeks has been a lot of urgent response to getting post-vention treatment to affected individuals, and then drawing up a more community-wide plan for going forward. We're going to be looking into providing a lot of what's called gatekeeper training, which is one of the brand names is QPR, question, persuade, and refer. It's an attempt to make a mental health version of CPR or behavioral health first aid. Our idea is to be getting as many people trained up to be community observers and community referrers who can provide initial contact with people who are not getting behavioral health therapy. The idea is to offer those trainings at no or low cost, and then provide a way for people to collaborate and refer people onward. We've talked with the Saltmore Senior Center about providing these trainings to caregivers as well as seniors. We've discussed providing these trainings to clergymen and lay people associated with the Interfaith Council. Our house, all of the assisted living facilities on the island are going to be offered this, and then we're going to have ongoing and persistent trainings and kind of quarterly meetings to allow people to share house things. Past that, and more specifically on seniors, hasn't been a lot of stuff. We didn't have our meeting last month. Past that, I've been following along with some expansions to the food security program, which should be affecting seniors in the next couple of weeks-ish. And that's about it that's senior focused for right now.
Security?
Food security. So there's the new way.
Food
Food
insecurity.
security, food insecurity.
Does that affect a lot of seniors on the island?
There does not appear to be a large percentage of seniors, there are definitely some people who are seniors who have been connected to expanded food services as a result of the food security project that Nantucket Resource Partnerships is doing. But mostly it's not hunger, it's insecurity in the sense of not having a reliable, consistent, and healthy source of food, which is another form of food insecurity, but does not qualify for the same programs that like a food pantry would do. So it's more people who either have difficulty turning food ingredients into food on a consistent basis, or people who are not getting the right type of balanced diet. So that's another kind of sprinkle to it. But as far as seniors going hungry, I do not believe it's a large population. If it is, we have not been able to find them or communicate with them after a couple of years of trying.
Are there any comments or questions for Jericho?
Yeah.
Okay, and then would you very briefly, you want to do like the old self-introduction?
Yeah,
Go ahead.
sure. So, again, my name is Erin Schrader. I'm the new, I have a very long title, but basically, public health nurse for the town is the quick version of it. So my job right now targeted towards seniors is I'm down at the Salt Marsh, and I'm sorry if you can't hear me, my voice is a little froggy. So I'm at the Salt Marsh about once a month. I think we're looking at scaling that up a little bit moving forward. But I do an Ask a Nurse program the third Tuesday of the month. I'm available for office hours, you can stop by. So I'm there for that. I do I feel like a lot of what I'm doing right now is program development, research, and lots of trainings actually right now. So, so lots of like desk time, administrative stuff, but I'm always available for calls. If you need a referral to the VNA, hit me up. I'll direct you that way.
So does one have to make an appointment to see you at the Salt Marsh?
No,
Just show up at the Salt Marsh,
just show up.
and once the day is
Yeah,
advertised.
the third Tuesday of every month from 11:15 to 12.
Thank you.
I have a question. Why are you scaling back? Seeing it's so difficult to get to see your primary care. It's so difficult to get an appointment at urgent care. Why would you scale back?
No, scale up. So like right now, I'm only going.
Oh,
But in time, we'll probably do twice a month.
oh, I see. I'm sorry. I thought you said scale back.
I don't know, maybe I misspoke. I apologize.
Okay, but either way, you're going forward, not scaling back. Oh, good. Thank you.
It's a frog in your voice.
It is, yeah, it takes the words too.
The idea is to have the steady state be 2 regular Ask a Nurse days and then varying programming as case is needed. And then hopefully to expand to at least one medical or technical related educational opportunity a month ongoing.
Any other comments or questions for Erin?
I have a question. So since you're new to your job, how symbiotic are you two gonna be? In your
More
job?
to come.
Yeah, that's
So
definitely
my
relevant.
understanding, I guess it's the outsider learning about this town nurse program. Is that, the town hired Heather, who was huge, but then COVID happened and that just was the focus, the only focus for the 3 years she was with you guys?
Basically, yeah.
So now, now that COVID is manageable, Erin's really developing this town nurse program that Roberto and Jericho fought for so many years to get, for the first time. So Erin's building herself and we're helping what we can and we'll just be bouncing back and forth. So, I'm already in my head like, well, if you ever need help, if you're only going once or twice a month, why don't we go once or twice a month and then someone's there every week? I don't know, that'd be cool.
So
So
next
that's
time,
kind of how we can work with each other.
so next time she'll be sitting over there next to you, not across from me. Start there, okay?
Yeah, I think, the idea is always to have as broad a resource base as possible, so that when, I was gonna say if, but when there's a problem, there's multiple forms of backup. Part of the problem is that for a really long time, there was the only resource for certain medical stuff. Like if you wanted a vaccine on Nantucket for COVID, you had to get in Heather's inbox or in her messages or wherever.
Yeah, I
And
remember.
We tend to have systems on Nantucket that require one person to be a hero all of the time. And as soon as that person goes, the entire system falls apart afterwards because it relied on that one person. So wherever possible, we're gonna try and build a deep and diverse bench of resources and services so that the loss of any one component does not cripple the whole thing. Like, we'll definitely, I mean, I think there's some exercise programming we're looking to get in
Yeah,
places.
yeah.
There's all sorts of stuff we're trying to do that, because we're only a staff of one nurse and one per diem, we need more labor. We
Yeah,
need more
I mean,
people.
it's been great, you know, even thinking about, one thing that Erin and her and Keziah do is like the TB direct observation, you know, for TB patients, watching them take their medications, right? But as we can now be trained in that and do the, you know, state training plus the physical training following these girls, then they can actually take a vacation, not have to think about their TB patients for a little bit, you know? Also Maven, I know it's a huge part of your job, so they're tracking the communicable diseases. And so, you know, if, again, she wants to go away or she's out sick, then someone from my company here or off island, we can all be, you know, picking up that for her. So, the symbiotic relationship, I think that you're looking for, I'm hoping we're gonna get there.
Yeah, no, I definitely, like, it went from being maybe we should partner with the Visiting Nurses Alliance on this to here's grant money we secured to get you guys started on things, and then to now part of our part of our planning for the year involves like your guys as an adjunct to the health department.
Yeah.
Providing needed services, so.
And we build, I mean, we build 15-minute increments, so even if it is just as simple as walking in and giving someone a COVID shot because she's out sick, you know, it's not a huge expense to the town to use us, so. It's been great under the grant they were given.
Nice.
Thank you. Anybody else, especially those who are not here in the room, questions or comments for Erin? Or for Kelsey?
And remember, if anything pops up to you later on, as a question you want, get it to Mary Ann or get it to myself, and we will make sure that you get an answer back.
Laura, you're next on the agenda to tell us what's going on in the Salt Marsh.
Hi, so everybody got my report of what is going on or what happened and what is coming up. Two really cool things that we've been doing is collaborating with the Nantucket Community Sailing for the Old Salt Sails, which they do every year. So that's pretty cool. They also put in some sails with the links, which is really neat. And the other is collaborating with the theater workshop. They, if they get sponsors, they will offer free tickets to seniors for opening nights. They did it for Boeing, and they're doing it this Friday and Saturday night for Rock of Ages. So if anybody would like a free ticket and you're over 55, you only need to be 55 for the theater workshop, you can email Sophia Reese and Hosey your tickets and how many you would like. So that's pretty cool. Other than that, we're busier than usual because summertime's here. Bridge is packed. We have more tables of everything, and it's like Grand Central again. So it's really nice to see everybody back and the place is humming. So any questions?
Questions or comments for Laura?
Nope, the newsletter is awesome.
Yeah.
Oh, thanks, Rocky.
Okay, thank you, Laura.
Yep, you're welcome.
The last thing on the agenda, I'm gonna take like 2 seconds to give you an update on the senior home modification, basically grab bars most of the time, some railings. We're ending the program slowly because we have a short wait list of 3 people, but we don't have all of our handymen anymore. One of them has a cancer diagnosis, so he's not able to do this anymore, and the others have left the program. Because of all the difficulties involved in actually executing one of these grants. So we'll try to take care of the 3 people we have on the waiting list, but we're not going to take any new people. So the program is winding down. Well, that's it.
I have a question.
Yeah.
When you said home modification, what's that entail?
Mostly it's grab bars, if somebody needs a grab bar in their shower.
I talked about the Oddfellows in their program.
You
I
did
gave you
tell me
Buzzy's
about
number.
That when we talked, so yeah,
That's the Oddfellows they do, that they have a nurse, they have a program that puts in, my wife had a stroke, they came in and
so you actually have handymen who can go into somebody's house and do this.
this is what they do.
Oh,
It's part,
okay.
it's not publicized, but it's something that they do,
So maybe I.
I
can
gave him
talk-
his number last time we met at
No,
the,
you can give me the
Salt
number,
and Sun?
something about this.
okay, I'll give you the number, you can call.
Okay, so we can talk about maybe finishing up this program that way.
If it's just putting in bars and things like that, I mean, I could find people to do that, they have to be, what, certified or just guys who put
Well,
bars in?
for this grant, you had to go through a query check, which is a background check, and you had to prove that you know.
I'll give you
Yeah.
Buzzy's number, then you can
an
talk to him, and I'm
all-time-
sure he'll be more than happy to help.
Perfect, thank you.
I didn't pick your brain on this just after the meeting.
Okay.
And we've come to the end of our agenda, so,
We do not have a quorum right now, so we cannot close this meeting. All we have, no, because Bob left.
oh, okay.
But that's
I
it.
thought we had one more than a quorum.
No, I believe it's Arlene, Judith, Abigail. No, we do, we got five.
Yeah, I think we have a quorum.
Oh, that's right. Because you came in, that's it.
Hurry before someone leaves.
Yeah, so yeah.
If
But I do have to get going soon, so.
We can wind it up right now. If everybody wants, if you're ready, then we can take a motion to end the meeting.
I make a motion to adjourn.
Rocky, thank you. Seconds,
I'll second that.
thank Arlene. And now I have to go down the list. This is required by law. Abby,
Yes.
Rocky,
Yes.
Arlene,
Yes.
Jude,
Yes.
Mary Ann, yes. Thank you, everybody. And see you in August.
Okay,
So we already, okay. All right, guys, thank you very much, everybody.
thanks, guys.